So, hey, I'm about to meet with a surgeon, which is kind of cool. We're going to be able to find out when, hopefully, hopefully, we're going to find out when the surgery is going to be scheduled and when they're going to be able to do it. It's hard to plan your life around this big, huge unknown. It's basically this huge hole in your life where you're going to need to recover. You don't know when it's going to happen. So that's really hard. So I'm hoping that today we find out when the surgery is going to be, that we can get a date and that we can plan for it and basically build our lives around that, because I'm going to be out of commission for several weeks, maybe up to 2 months, maybe more, depending on how things go. So anyway, we're excited to meet with the surgeon. We were sitting in the office. While we were sitting there, we thought, hey, let's look up our doctor. So looked him up, had great reviews. I don't know if something goes wrong, if you can't leave a review then if something goes wrong. So, but I guess other family members possibly could. So anyway, we feel good about the good reviews that are there. So seems like he's been highly recommended by a lot of people. So we're excited to meet him and find out more about what's going to be happening with the surgery. All right, so just got out from talking with the surgeon. He seems excited because he gets to work on someone who's relatively healthy, which I thought was kind of funny. But he's leaning towards mechanical valve. He'd really like to do a mechanical valve. If not mechanical, it'll be a cow valve. He says we're not in a hurry to get it, and it's going to be at least 3 weeks off because he's booked for 3 weeks. So anyway, he said I could exercise normal. He's like, you can wait 3 months, but I wouldn't wait 6 because my heart's going to start to enlarge. Basically, it's going to get more complicated if I wait longer. So, and then once your heart starts enlarging, it doesn't go back. It doesn't shrink again and get better. So I got to think through this whole mechanical valve thing. It's a commitment, but then maybe I don't have to do this surgery again, but then I'm on Coumadin for the rest of my life. I'm testing my blood viscosity. I don't know. That's a hard decision. So I'm gonna have to really dive into that. But ultimately, I have to get the surgery again. So that's coming up, and I got to figure out how to plan my life around that and everything I do around that. So anyway, that's the update, and I guess we'll see where it goes. Looks like a good doctor. I do like him. He is super nice. Seems like he knows what he's doing, and he was late for a meeting, but yet stayed and answered all my questions even though he was late. So that was really nice.